So could you identify maybe one of your signature efforts in SDOH? And I think you have some news today about the parent company investing in an outfit called SIA that's in Boston. That as I was reading the press release a little bit quickly, is a group that's interested in starting minority and women-owned healthcare enterprises. So maybe just, if there was if there was one, if I said you only have one SDOH effort to talk about, what would it be? And maybe you can fill us in a little bit on today's news.
Oh, wow. It is hard to select a single SDOH or racial and health equity strategy.
I
Just
know
because of the very nature.
You love all your children equally, but
I love all our children equally, but even the notion that it's the nature of systemic racism, and it's the reality that every individual is affected by a different core driver of health. I'll just I will very much pick a few if I could. One of the things we're very much focusing our efforts on is food insecurity. So we have heavily invested, and it's one of the areas I think where we can make a meaningful impact, not just at Blue Cross, but actually in the community writ large. That health systems and health plans together touch nearly every member of a state. If we essentially said we're going to solve for hunger, and in fact, one of our systems in the state has invested in a food pharmacy, because what they found is that there was a high utilization of emergency room visits because of so many of their members being hungry. The cost of buying food for someone for a year is far less than a single emergency room visit, essentially, if you think of it that way. So these are the types of initiatives that very much make sense. The announcement we made today about SIA has two effects. One is very much focused on investing in minority-owned businesses. One of the major drivers of inequity, systemic racism, is that we haven't thought equitably about how to apply, who to partner with, how to make investments in all sectors of our community. And so if we truly want equity, we want to make investments in minority-owned businesses. And those minority-owned businesses are focusing on innovation specifically that relates to social determinants of health and health inequities. So that's why we've made such an important investment in these venture funds, because, again, social determinants of health for us are in the ounce. And so if we start to think inventively about how we can broadly reduce inequities, then the payoff for a community is going to be quite significant.
And
the only other example that I would give, which is really a tremendous success story, is we've been working for several years now with a community in Minnesota, Wilmer, Minnesota. And the concept and the opportunity that we had is, because we insure so many members in the Wilmer community, we could significantly influence, in partnership with that community, addressing multiple social determinants of health. There aren't as many disparate stakeholders. So we had some great success of both funding and then facilitating and empowering the community to say, well, if you were to solve for as many of the social determinants as you could, do we see improved health in the community? And we're waiting and watching to see those results. But those are the sorts of things that we should be investing in. Health plans and health systems shouldn't just stay in their lane. They should get outside of their lane and realize that we're not just claims and network companies, that we should be health equity companies, we should be care delivery companies, we should be data companies.
Well, it'd be very interesting to see what happens. And Wilmer was sort of sounds like a, for lack of a better word, sort of a holistic approach where you're rather than zeroing in on one determinant, maybe trying to tackle all a web of
Yeah.
determinants, if you will. So,
One other one that I'd give you that's more recent, if I could. We've also been working in partnership with Hennepin County Medical Center to support a mobile vaccination program. That's another one that is very much important, critical right now. That one of the things we haven't seen is childhood immunizations at the levels that they should. And the same would be true of people getting access to the COVID vaccine. Rural communities or socially disadvantaged communities are going to be the ones that are at the greatest risk of not getting vaccinated. So these are the exact types of investments that we should be making now. Sorry to interrupt.
no, I interrupted you, but sometimes I think that's a sign of a good conversation, if it's not taken to excess. So let's just quickly talk about the COVID-19 vaccine in our remaining minutes. It seems like even next week, the Pfizer vaccine will get an EUA. And I'm interested in what a health plan is going to do in terms of, I guess, two things. One, encouraging as many people to get a vaccine as possible, but also making sure that people don't get hit with some sort of high facility fee. They think they're getting the vaccine free, and then there's a bill that comes because of where you elected to get the vaccine. So you started to talk about what you're doing to encourage people to get the jab, but also what are you doing to sort of protect people from some sort of hidden and slightly obnoxious cost to getting it?
Well, I think what we're doing is exactly what we've been doing since the beginning of the pandemic. We, along with many other Blue Plans and other organizations, made the determination at the very beginning of the pandemic that now is not the time that people should worry about insurance continuity or out-of-pocket costs related to COVID. And I think that is absolutely true as it relates to the vaccine. The vaccine should be available at no cost to anyone who wants the vaccine. And so that is a commitment that the government has made. That is a commitment that we as a health plan have certainly made. And, we very much are cognizant of and want to watch out for surprise billing or other channels that would have patients pay a surprise bill for a service that very much should be provided for free. So I think we're highly cognizant of that. And I think one of the roles that we play is to really educate and inform the people in our state about how to avoid those surprise bills and what is the right doorway. No, actually, what are the right doorways? Because there are going to be many. What are the right doorways to walk into to assure that there isn't fraud or there certainly aren't quality concerns regarding the vaccine, just so we make sure that people get the vaccine. One thing that I really do want to end with, I don't know when the story will show, but what I also worry about is it's going to be some time before most folks have access to the vaccine. And so we're in a point where the virus, the pandemic is at its worst. So I'm worried about how we're going to navigate the gap. That we should not let our guard down. Just because a vaccine is around the corner, we have to remain diligent, mask wearing, hand washing, social, physical distancing, because a lot can happen that's bad between now and the point that everyone gets the vaccine. We will help everyone get the vaccine that wants the vaccine, but we want people to be healthy enough by the time they can get access to the vaccine that the vaccine will benefit them.
So how are you using your communications channels to address this problematic period, which I think you're on to something. There'll be a huge sigh of relief. There'll be, if not dancing in the streets, just the pandemic will look different when once a vaccine, and it appears to be effective, is out there. But it's going to be months before many people are vaccinated. So,
Well, we have been very vocal. You probably can sense from all of our discussions that I'm not shy. We over communicate, and we've wanted to be close with both our teammates as well as our community, and certainly the members that we serve, so that we can be sort of a clear and trusted source of information for everything related to COVID. So we have been very overt about our hopes and recommendations for the people that we serve. And I would even go so far as to say that we've been provocative. We've been part of a team of many other health plans and providers in the state to launch even a media campaign over the course of the last several weeks that bluntly and frankly very provocatively talks about the risks of this virus. It's out in market now, and we want to keep doing that. And I recognize that it's highly politicized, and not everyone loves what we have to say when we're provocative about being safe. But we are in the health business after all, and our true north is keeping people healthy. So we are biased toward health, and so we are boldly and provocatively asking people to take care of themselves and each other.
well, that sounds really interesting, provocative. I hope I'll have to find a way to look at what you're
We'll
doing.
make sure that you can see what's out in the market, and Jim can help connect you with that. But now is a very critical time, and as I said, I worry most about navigating the gap. We talk about that in other parts of our life. How do you live the dash? I think I've heard the expression. For me, it's the same. The dash is December 2020 to, let's say, June 2021, the hyphen. Let's really pay attention in that hyphen, because really don't want to see anyone else get sick if possible.
You're reminding me of the slogan on the London Tube, "Mind the Gap." So
There you go.